Morobe Governor Luther Wenge today asked the Minister for Health Dr Lino Tom about bringing in overseas doctors to support the health workforce in the country. Currently, the ratio of doctors to patients is uneven. Dr. Tom said there are only 602, which is not enough. According to the World Health Organization standards, the ratio is 1 doctor to 1,000 people. In PNG, one doctor is serving at least 17,000 patients. This is alarming.
We have a population that's growing out of order, and yet we have a constant number of doctors being produced every year. Now, to make matters worse, we had about 50 doctors who stood for elections in the last election. To bring them on board on short-term contracts is actually taking a bit of time. Now we plug in this big problem where there's about one doctor to 17,000 people. So that problem is not only peculiar to the Morobe province, it's actually a problem that's affecting all of the country.
Dr. Tom also said the country's medical school is producing a constant number of doctors, but not exceeding 60 every year. He says the government can look at short-term measures, including looking within the region for competent doctors well suited to our systems. While this can be achieved, funding is the biggest challenge.
The government is looking at some short-term measures, also is looking at some long-term measures, and one such long-term measure is to increase our capacity so that we can produce the number of doctors that we need in the country. So wisely the government has actually given the direction to our university to actually allow medical school to become a university of its own so that it can, with that increased capacity, so that we can also increase the number of doctors.
Minister Tom also mentioned that only 5,500 nurses are currently serving in the country. It is also a challenge for the sector. Freddie Mo, TVWAN News.